Hi, I'm Angie Osgothorpe, the president of the Davis Chamber, and I'm here with Troy Wood, the CEO of Lakeview Hospital, and we're so excited to talk to you today.
Thanks for having me.
Good. Hey, I have a question for you.
Very good. Very good.
One of the two of us is a Nashville recording star.
Yeah.
Can you answer who is between the two of us?
Okay, if what you mean by a Nashville recording star is someone who has voice recorder on their phone and they're driving through Nashville and they record a song, that would be me.
I see. So that was the Nashville recording
Yeah,
star,
right,
huh?
right.
No, that goes more than that, I know.
I did a little bit. In fact, I met a physician when I was living in Texas who just had far too much money, and he wanted to go lay down a bunch of tracks. So we ended up doing an entire album, and it was just a lot of fun. But it's been a little time.
It's been a little time,
Yeah.
but you're still active with your band.
Yes.
I just saw you this summer.
Yep.
And
We
you
have
were
a lot of
awesome.
fun. Yeah.
And we're not going to give away surprise, but come January there might be a surprise with that band,
Right,
right?
right.
Yeah,
We'll
we're
do
working on
something.
it, so it's too early to tell. So anyway, hey, I have another question actually about the hospital.
Okay.
So what makes Lakeview unique?
Okay. Let's start with quality. Something that we're really proud of that maybe not everybody knows is that Lakeview is only one of 2 hospitals in the state that has a 5-star rating with CMS. That's the Center for Medicare and Medicaid. We're also a top 100 hospital by Truven Health Analytics, and so top 100 in the nation. And so that brings the metrics that they use. They would say higher patient engagement, lower overall cost of care, and lower infection rates, and lower lengths of stay in the emergency department. All of those metrics go into this conglomerate algorithm, and then we're just fortunate to be at the top of that list.
That's a pretty good list to be on the top of.
Yeah, we're very proud of it.
Yeah, very good, very good. So tell us some of the services that you offer here at Lakeview.
Of course, it's a full-service hospital, regular hospital, so as you might expect, OBGYN,
Right.
urology, oncology, all of the traditional services, but we really focus a lot on orthopedics. We work with some of the best orthopedics in the state, and we're just fortunate to have that partnership.
Mm-hmm.
And so because that's one of our focuses, we've gone after things like Joint Commission accreditation for hip and knee, only hospital to have both of those, 5-star rating from Health Grades for orthopedics. Another service line that we venture into that we do really well at is adult and geriatric psychiatry, behavioral medicine, and so those on top of what you would normally expect at a full medical surgical hospital.
Well, that's definitely needed for all of us, but especially geriatric.
Such a need in our community.
Yeah, very good. And the orthopedic, as long as we keep liking our sports and our
Right.
skiing and our whatever, we're
If
keeping
you
everybody
enjoy
in
life,
business, right?
you'll come see one of our hospitals
Very
sometime
good.
or another.
That's awesome. That's great. So we really appreciate Lakeview Hospital and the good partnership that we have with the Chamber. You and I particularly have talked a lot about leadership and different styles and things like that. Tell us about what's your style of leadership, or give us some tips on how you like to lead an organization.
Sure. Well, there's a phrase that you probably heard. It says, "Culture eats strategy for breakfast."
Mm-hmm.
What that means is every hospital, every business really has a really good strategic plan. It's in the execution of that plan that makes the difference. So my job, I believe, as a leader, as the CEO of Lakeview Hospital, is to give us direction and focus on the culture. So the culture really focuses here on the mission. Our mission is to provide the quality of health care we want our closest loved ones to receive. Everybody knows it. It's easy to remember. And when the standards come out of, are we going to do this, are we going to do that, and what's expected of us, the highest standard that I could think, even beyond top 100 hospital, above 5 stars, is would this be okay for my mother? Would this be okay for my father?
Yeah.
So my job is to set that bar as high as possible. And then it really is about that culture, me getting to know them, them getting to know me. So I walk the halls daily. Every new employee orientation, they see me for the first hour and almost the last hour as well. And I'm talking about things like the outward mindset, if you've read that book, talking about seeing people as people. What people probably don't know about me is that I haven't been a CEO my whole life. My career started out as a licensed clinical social worker.
I did not know that.
Right. And so I bring all of that. Everything is about culture and motivation and what makes us tick. So now, instead of having therapy sessions like you and I are having here, I feel like I have 600 clients. They're called our employees at Lakeview Hospital. I have 300 other clients called physicians. And we're practicing social work at the macro level. getting everybody bought into the same vision and the same goals.
That's awesome. I was just listening to a book this morning that said, it used to be that our work was about our brain, and in the future, and now it's about our heart.
Yes.
Do you agree with that?
I love that.
Yeah.
Yeah, everything is about heart. And if everybody's heart are aimed in the right direction, you're going to achieve something special.
Very good.
It's when people have differing ways of going about things and they're not on the same boat that you get variations in quality. For us, in fact, variations in quality. And so we avoid that by all aiming at the same thing.
That's great. That's great. And that's not as easy as it sounds.
Very challenging. There's 35 different departments in the hospital, and as you can imagine, they don't all see everything's the same way at the same time. You have an emergency department that finishes with the patient. Med-surg is ready to receive them or not. That's when the magic happens. Who's going to win? Who wins in these challenges when there's conflicting objectives? Well, the patient has to win. So who wins is the patient, and we have to always remember that.
That's very good. Excellent. I've been here with Troy Wood, the CEO of Lakeview Hospital, and I have one last question for you. Now, this is a special question since you're on the board, executive board. What is it that you love about the Davis Chamber?
Oh yeah, I mean, there's a lot of things to love about Angie and the board. Obviously, every week you have an opportunity to interact with members of your community. We share secret sauces about how to get along in this community, what we know about things. We're building those relationships. I would say, though, the number one thing that I take away from the chamber is the impact that we have on legislation. So the Legislative Affairs Committee meets all during the session. We meet on a Thursday, and then we meet with our senators and our representatives the very next morning. And we as a group have kind of decided where we want to go. We have a representative there share those ideas, and they get to hear those ideas. They can challenge us back, but most times they're interested in what we have to say. And then law gets created based on a lot of what Davis County has to offer our legislators.
That's great. And it doesn't hurt right now that the Speaker of the House and the President of the Senate are both from Davis County, right? Yeah. So we've got it going on, right? When you say we got it going on?
Yeah.
Very good.
I say we have a lot of influence.
Yes, very good. I would agree with that.
Yeah.
Hey, thanks, Troy.
Thank you.
Appreciate it.
Appreciate you guys.